Good morning, everyone. Imagine lying in bed at 2 a.m., feeling exhausted, yet unable to sleep as worries about tomorrow and life's what ifs swirl in your mind. That knot in your stomach, that racing heart rate is more than just stress, it may be anxiety. The word anxious often is described as fear, but it isn't just fear. Fear is an emotional response to an immediate threat, while anxiety is the anticipation of a future concern and is more associated with the worry for extended periods of time. While we often think that this is a personal struggle, it's actually a room-wide or worldwide issue. Anxiety is an umbrella term and consists of symptoms and different types of disorders. Defining anxiety as an umbrella term requires an understanding of symptoms and the effect it has on the mind and body. According to the 2018 report from the Mayo Clinic, a common anxiety symptom is elevated or increased heart rate. Now, to put in perspective, a normal person's resting heart rate is 60 to 100 beats per minute. Now, factor in the anxiety, it can go up to 150 to 200 beats per minute, twice as much as a normal resting heart rate. In the same report, anxiety can lead to or worsen other physical symptoms. Other ones to consider is digestive or bowel problems, headaches, and chronic pain. So imagine you already have certain symptoms or diseases. Anxiety can increase it because it isn't just a mind game, it actually puts a lot of stress on the body. Let's now identify cognitive and emotional indicators of this what-if mindset. According to the National Institute of Mental Health, a report published in 2024, one cognitive and emotional indicator is feeling restless or having trouble sleeping. So putting that to perspective of what I talked about in the intro, it isn't just one example that I made up or anybody else doesn't feel. It actually is a symptom of anxiety. Same report gives us another symptom in correlation, which is having a hard time concentrating. Now imagine how that can do to your day-to-day life. The umbrella of anxiety can further be understood by looking at different types of disorders. Now let's talk about one that is called generalized anxiety disorder. Going back to the National Institute of Mental Health report, generalized anxiety disorder usually entails a persistent long-term anxiety or feeling of dread that interferes with daily life. Now, to be diagnosed with this, you do have to have this persistent feeling for about months to even years. Let's discuss other specific characteristics of other more complex disorders. I'll go into the definition, but I won't go into it further. Going back to the Mayo Clinic report, one disorder to look at is a panic disorder, which is repeated episodes of sudden feelings of intense anxiety and fear of terror that reach a panic within minutes. The American Psychiatric Association reports that another disorder called agoraphobia is defined as an intense fear and avoidance of places or situations that might cause a person to feel trapped or even helpless. Anxiety is more than just a fleeting feeling of stress. It's a complex, future-oriented response in impacting the mind and body. We examine how anxiety shows physical and cognitive symptoms. Next time you're awake at 2 a.m. with a racing heart rate, remember that it isn't all in your head. It's your body's response to what it perceives as an inevitable danger. Understanding these symptoms and disorders help us shift from the what-ifs to a better grasp of our mental health. Thank you.